all, and welcome back to my channel. On this page, I talk about technology and money. If you're new here, welcome to the channel. You're welcome here. Please do consider subscribing to the channel and also liking and sharing this video. Liking and sharing the video does two things. Number one, it helps this content reach more people, so you are adding value. And then number two, it encourages me to continue creating content that you all find helpful. So before I get into this week's topic, I just want to take a minute, just take a moment to just say, how was your week? Did you have a chance? Have you had a chance, especially for if you're a non-clinician, if you're a clinician, if you're a nurse, a physician, some type of ancillary provider like a social worker or anything like that, anyone really, but especially if you're a clinician, since today's topic is around providers. But have you taken a moment for yourself this week? You know, have you taken a minute, 5 minutes to just kind of, just stop and breathe and have a moment of peace? There's a lot going on. Let me turn this off here. There's a lot going on in the world, and it's just a lot. So whichever day you watch this replay, I just hope you had a good week and you had a moment to take for yourself. So today, y'all, today I want to do a part two. Today's topic is Nurse Blake. We're going to talk about the Joint Commission, like the real Joint Commission, and the reach of nurses on social media, or even the power, but particularly the reach of nurses on social media. And this is a part two. So I want to say, last month, I did a video, and at some point after the replay, I'll link that video up here in YouTube. And then I may also leave a link in the description. But yeah, I did a video about Nurse Blake, and he is a very popular nurse influencer on social media. His reach is across multiple platforms. He has I think almost 1 million followers on Facebook. I think he's upwards of 1 million on Instagram. He's real heavy on TikTok. I think he's at about 1 million on TikTok. He has millions of followers across the social media platform. So he's definitely a nurse influencer. And I did a video last month about the work that he's been doing using his influence around safe staffing, and then how the influencing he is doing is putting pressure on the Joint Commission and petitioning the Joint Commission around mandating safe staffing. And if you're a non-clinician, if you don't work in healthcare or don't have anyone in healthcare, what the Joint Commission does in a nutshell, and don't come for me if I misstate anything, because you could always Google it. You can always do a search. But what the Joint Commission does is they provide a set of standards. They accredit hospitals and healthcare facilities where patients receive care, long-term care facilities, ambulatory clinics, etc. The Joint Commission does surveys, and they visit these facilities, and they have standards around lots of things in healthcare, not just they don't have staffing. That's one of the things that Nurse Blake is influencing and petitioning the Joint Commission for. But the Joint Commission has standards around different avenues of patient care for facilities, for handling things like health disparities and infection control or infection prevention, etc. So I will be sure to link that video. But today I want to talk about, because this is an ongoing story, and one reason why I'm so intrigued in following the Nurse Blake story and following what he's doing with petitioning to the Joint Commission is I've been a nurse for about between 23 and 24 years. I'm not an old school nurse, but I'm not a new school nurse either. So I'm young enough not to be considered, I guess, not too much of a senior nurse, but I'm also old enough to, I remember when we used to still do paper charting. Okay, so when flow sheets were, especially the ICU flow sheets were just big and long, and you did all your charting by hand. So I've been a nurse for a while, but in all my years of working in healthcare and thoughts of my own, I do want to say that, make sure that's clear and fair use. But in all my years of working in healthcare, I haven't seen that. Just because I haven't seen it doesn't mean that it doesn't happen, right? I mean, it has not happened in the past. I want to make that very clear, right? Because maybe there has been levels of influencing from nursing outside of social media that has occurred in the past, not to the level that I've seen it. But I'm saying for me, I have not seen where a nurse has the reach that he has to go to the Joint Commission and petition the Joint Commission like he has, and rally using the power of social media and the reach, because there's a lot of nurses on social media. If you are a healthcare administrator in any avenue or capacity, there's a lot of, especially on TikTok, there's a lot of nurses on Facebook. I'm not too big on Facebook, but I know there's a lot of nurses on TikTok, and there are nurses that are, they're talking, they're communicating, and you have these nurse influencers. Like I shared some in my first video, and there's some even more now, but they have a lot of reach and they have a lot of influence, not just Nurse Blake, but I haven't seen it to the point where a nurse influencer, someone who is not necessarily, a politician. Okay. So it's not like someone who has been voted into office, voted into office, like in Congress, but I haven't seen it to a point where a nurse has influenced to the point where a petition has gotten to the point where it gets to the Joint Commission's front steps, which, if you haven't seen the story, that's what happened this week. And it's just really intriguing to me how nurse influencers are using the power of social media to reach nurses literally. Well, at least I'm in the United States, across the United States, getting nurses from across the United States to mobilize. I don't know what's happening with nurse influencers outside of the country, but I haven't seen it to the point where it's gotten to the Joint Commission, to the point where, and I'm going to share an article, I'm going to share my screen here in a moment, where it's made the news, right? The Chicago Tribune did a huge article about it. He had billboards. So he has influenced to the point where nurses could, converged in Chicago, and he had ads running on the news, ads running on television, news cameras, all the signatures from the change.org petition that he did earlier this year, got over 500,000 signatures from nurses across. I don't think just nurses though. I think also like maybe physicians or just anybody could have signed the petition, but over 500,000 petitioners signed this change.org petition that got delivered to the Joint Commission's headquarters, to the point where people are converging on the Joint Commission social media pages, especially on their Instagram. I've gone to the Joint Commission's Instagram, like when it first started bubbling up, and they don't have a lot of engagement on it. They didn't have a lot of engagement on their social media before all of this. And now when you look at, and this is the actual Joint Commission, when you look at their social media pages, especially on Instagram, you can see where nurses or people, I don't know if they're all nurses, but people are leaving comments and not harassing the Joint Commission, but just really leaving comments like, what are you all going to do? And they're posting about stuff like around health disparities or workplace violence, which are very important topics. And people are like, well, you're posting about this, you're kind of tone deaf. You're not responding to what, this petition is saying. So I haven't seen it. I have not seen this level of engagement using social media for nurses to a level of engagement and putting it to the Joint Commission like that. I haven't seen it, and it's really interesting to watch it continuously unfold. So what happened this week in Chicago, I'm not too sure if this is the end of it, right? Because like as I put in my the first video that I did last year, Nurse Blake did a nationwide comedy tour. Most of his stops in cities across the country were sold out. Okay, so he was selling out like theaters, and there were nurses, and and you think about when someone does a tour like that, you can collect the data, and you kind of get an idea of like who's attending your tours. And I wonder in that first video for this, I wonder if that was the plan all along, part of the plan, very strategic. And it's just really interesting to watch and unfold and see nurses engaging in activism like this. I haven't seen it. Now, there have been in the past where professional organizations like state nursing organizations will have, they will hold like their day at the Hill, right? They were like a day at Capitol Hill or day on the Hill, or that's like nationwide, or within a state where the professional nurse organization will have like a day at not Congress, but the day at the legislature, right? I have seen that, but not to the point where someone is not part of a professional organization, not a politician, but having so much influence. That's what has intrigued me. Okay, so let me share my screen here. And we'll just read through the article from the Chicago Tribune. So this is not a, it's interesting. Okay. So y'all should be able, yeah, y'all can see that good. Okay. I think I'm getting a little bit better, y'all, at screen sharing and learning. Okay. So this week, so as I mentioned earlier this year, maybe like around the January timeframe, December, January timeframe, Nurse Blake, he has combined forces with what do you call those organizations that not a PAC, not a political action committee, but there's a word for it and it is slipping my mind. Anyway, so he had it's called Impact Healthcare. There's an actual name for it, and it's going to come to me, and maybe in this article. So they use that change that he combined with this organization. They had the change.org petition and asked like nurses and people to sign this petition to have the Joint Commission add additional standards around safe staffing and mandating what they consider to be safe staffing ratios to make it part of the accreditation that Joint Commission does when they visit hospitals for certification. Okay. So that happened this week. So what Nurse Blake and his team did the weeks leading up to this, they said, okay, we're going to go to Chicago. And the Joint Commission is based either in Chicago or outside of Chicago. We're going to take all of these signed petitions, which I said was over 500,000, and deliver them to the Joint Commission. And that's what they did. So let's read through the Chicago Tribune article. And as I like to say in the videos, y'all, please don't believe everything I say. And that's with not just me, but with just anything that, any other YouTuber or nurse influencer or just anything you read online. And that's not just with, in healthcare. That's also anything you read about like managing your money, managing investments, buying things. Just don't always believe what one person says. Okay. Always do your due diligence. Okay. So yes. All right. So social media, and I will leave a link to the article below in the description. So social media influencer Nurse Blake is petitioning the Illinois-based Joint Commission for safer nurse staffing at hospitals. So you see here where there was dozens of nursing students. That's something I did leave out. And supporters as they gather outside the Joint Commission offices in Oak Brook Terrace with boxes loaded with 540,000 signatures calling for safe staffing ratios for healthcare centers as a condition of accreditation. That's huge. On March 15th. So today is the 18th. So that's what, 4 days ago. Nurses also took turns telling personal stories on burnout, handling low medical supplies, and patients suffering during what's been happening over the past couple of years. So can y'all see that okay? Should I make that a little bit bigger? Let's make it a little bit bigger here. I want to be inclusive. Make sure everyone can see that. Okay. So, and I won't read the entire article. I'll just read through like the highlights. So a social media influencer is galvanizing nurses across the country to petition an Illinois-based organization for safer staffing at hospitals and other healthcare settings. So if you're a non-nurse, that could be other healthcare settings could be considered like a clinic, an ambulatory clinic, or it could be a rehab facility or a long-term care facility or a skilled nursing facility like a nursing home. So that's what other healthcare setting could be. A campaign that this week has included a rally, commercials on local TV, and a mobile billboard traveling to Chicago area hospital. So that's why when I say I find it interesting that he being Nurse Blake is an influencer and he's not a politician. Okay. And he's not part of a professional organization. He does have his own company, but it takes money to do these things, right? It's not cheap to advocate. Like it's more than just, flying to Oak Brook Terrace and going to the Joint Commission headquarters. There were commercials on TV. There was a mobile billboard driving around the city. And Chicago is a major hub, right? This is not, a 1,000, 2,000 person township. This is, a major metropolitan. So Florida nurse, I didn't know he was from Florida. Florida nurse Blake Lynch, also better known as Nurse Blake on social media, has been working with Change.org and a Virginia and New York City-based advocacy group called Impact in Healthcare Advocacy Group on the effort to ask the Oak Brook Terrace-based Joint Commission to require safe staffing ratios as a condition of accreditation. The nonprofit Joint Commission accredits and certifies healthcare organizations across the country if they meet an array of requirements, right? So, okay. So Lynch, who's also known for posting funny videos about nursing on Instagram, TikTok, and Facebook, started a petition on change.org about the issue that so far has more than over 500,000 signatures, making it the largest healthcare petition on the platform this year. And that's what someone at change.org, that's huge, y'all. Yeah, that's huge. Okay, I didn't realize that. So that's really big. Okay, so change.org and Impact have been working with Lynch to run commercials on local TV stations in recent days on the topic. And they've been sending a mobile electronic billboard to major Chicago area hospitals, including Stroger, University of Illinois Hospital, Northwestern Memorial, and Rush University Medical Center, among others. So these are like major healthcare facilities, okay? These are not just, 100 bed, as I understand. These aren't just 100 bed hospitals. These sound like health systems. I don't know a lot about the number of beds of like a Stroger or Rush University or University of Illinois, but I'm going to make an assumption here that if you have a facility that's associated with a university, I'm thinking a couple of hundred beds. I'm thinking at least at least 300 staff beds, if not upwards of past 1,000 staff beds. So that's a lot of nurses. That's a lot of healthcare providers. Okay, let's read on. They also held a rally Tuesday outside the Joint Commission's headquarters that drew several dozen people after delivering the petition to the organization. In addition to asking, so from here on out, I'll call the Joint Commission JCO. Just that, and that's the acronym for the Joint Commission for my non-nursing folks. To require safe staffing, Lynch and Impact want JCO to develop a task force of healthcare providers to determine appropriate staffing ratios across different settings and disciplines, annually report hospitals' compliance with certain staff ratios, and develop peer-reviewed research on staff and ratios, among other things. Wow, that's a lot. So here are the boxes of petitions. And they placed those boxes there at the Joint Commissions at the door. I did look on Nurse Lake's. He had the stories. You know how on Instagram you have your stories, and you can see where they like walked up and dropped the boxes at the front of the Joint Commission. Nobody came out, which I didn't expect, right? Because it's a little, I wouldn't expect anyone from the Joint Commission to come out, but Okay, so Dr. Jonathan Perlin, Joint Commission President or JCO President and CEO, said in a statement Tuesday that what's been going on brought additional attention to the need for more trained healthcare workers and the need to focus on their health and well-being. But he said, staffing is a complex issue that is larger than and cannot be resolved by the JCO alone. Now that I agree with. I agree with JCO's president and CEO on that. Just because, staffing is just, you can add more people, yes, but it's taken into consideration budget. It's also taken into consideration patient acuity levels. It's also taken into consideration things like expected discharge. So here's the thing with patient flow, because I did work in patient flow for a few years. Here's the thing with patient flow. You can staff in a bed, say at 7 a.m., right? Or staffing a unit. Let's go bigger than a bed. So staffing a hospital unit, depending on that hospital unit census at 7 a.m., you may need 8 nurses. Okay. And this is just very hypothetical based on the census of the unit. So when I say the census for the non-nursing or provider people, the hospital census is how many patients are in that hospital unit or in the hospital at any given time. So like say if a hospital has 400 beds and on a 140 bed unit, you may have all 40 beds filled. You may only have 20 beds filled. Okay. So in a hypothetical situation, say you have a 40 bed inpatient unit, just a 40 bed medical surgical inpatient unit. At 7 a.m., if all beds are full, you may need 8 nurses, hypothetically, to take care of all 40 of those patients. But here's the deal with patient flow. At 7 a.m., you may have 40 patients on that unit, but by noon, you may only have 34 because 6 patients have gone home. Maybe some patients have gone home. Maybe some have transferred to a high level of care. Maybe they've gone to the ICU or a step down bed. Some may have been discharged to a skilled nursing facility. So you start having discharges. So the 8 nurses that you needed at 7 a.m. to care for those 40 patients, because by say 3 p.m. in the afternoon, you may only have 25 patients, hypothetical. You don't still need 8 nurses to care for the patients in that bed, right? Because the amount of patients that you had at 7 a.m. is not the same amount that you have at 3 p.m. So it's just the ebb and flow. It is really like, it's almost like chess, right? So that's the thing. Staffing is complex. Because, and the reason why I mentioned that is because the staff beds, like say if you still had in this scenario, where you have, you started the shift with 40 patients and 8 nurses, by 3 p.m. you only have 25 patients. You still don't need those 8 nurses to take care of 25 patients. So, they may send someone home or et cetera, or float them to another unit, because if you keep those same 8 nurses for the 25 patients, you may run over budget. So then you have to look at, like, if you're a charge nurse or a nurse manager, you have to look at the time of day, the acuity of the patients, discharges, admissions, transfers. It is complex, and that's just for one unit. Imagine doing that for a whole hospital or a whole health system, or et cetera. So I agree, and that's just one scenario around staffing, and that's why I say I agree that it is complex. And I don't know if it can be resolved by the JCO alone. Again, my opinion don't come from me. It's just based on what he's saying with that statement here in the article. I hear what he's saying on that. Okay, so we look forward to working with other authorities on this issue. The context of Tuesday's events is not one that is conducive to the meaningful dialogue required. Unfortunately, there is no one-size-fits-all or immediate solution. Addressing the root causes of the staffing shortage is the only way to create long-term and sustainable improvement. So root causes, what is the root causes? So, okay, that's interesting. I haven't read through this entire article. I just kind of glanced over it earlier. Okay, then the article goes on to talk about how hospitals are facing staffing shortages, partly because of burnout. That I agree with. Travelers. I saw some other articles today, like 2 other articles today. I didn't pull them up here where, because staff in a hospital or inpatient unit with travelers can be very expensive, and rightfully so. Travelers have get a pay on their premium. Doing that for the long term can become very expensive. And I read 2 articles where it says that it looks like, I don't know, I haven't dug into it, where it looks like travel nurse pay is starting to get capped, because it's just getting to be real. It's a very expensive solution for staffing shortages, and I don't think it's sustainable as I understand it. So, safe staffing in hospitals has long been a key issue for nurses union, which cited it as the main reason for strikes in recent years. Oh, wow. So I didn't realize that nurses had striked. Again, I had not read through this whole article. I just glanced over it. So it's interesting. So JCO is in Chicago, and these facilities that the campaign that Nurse Blake and Impact Healthcare petitioned for this week went by the hospitals that have had strikes. Wow. Often the nurses want hospitals to meet ratios for the numbers of patients allowed per nurse. So that's what I was talking about. It's interesting. Again, I had not read through this entire article, so it's interesting. So that's why I was talking earlier about looking at the number of nurses you need to take care of a certain number of patients, but it also depends on acuity, etc. Some hospitals have commented that they staff based on patient acuity, meaning they aim to align patients' needs with nurses' skills, and that I agree with. So you do have to do that. It's a very delicate balance, y'all. It is. If you don't work in nursing, like staffing and staffing ratios and looking at patient acuity and patient flow, it is very complex, and it really requires someone, and I'm just talking about just for one facility, it just requires someone to really understand how patient flow works, but also how budgeting and things like that work. But Again, that's just one opinion. So Illinois law requires hospitals to staff based on acuity and to have committees of nurses who make recommendations for hospital staffing plan. California has a law requiring that hospitals meet certain ratios. And I saw some videos from nurses on TikTok, and I wish I had pulled them up here, where there were some travel nurses on TikTok talking about how they like traveling to California because their nurse to patient ratio is capped. So without that cap, if your nurse is okay with the cap, for example, it could be, and this is just again hypothetical, with a cap on ratio, it could be like a nurse can never have more than 4 patients. Again, this is just an example. Without the cap, the ratios can go as high as, until a nurse refuses, you can have 1 nurse for 10 patients. And that's just an example. But I have seen some videos from nurses on TikTok talking about one reason why they do like traveling to California, because of the cap on ratios. So Lynch and Impact said they didn't organize the overall JCO campaign with the unions. Okay. The Illinois Nurses Association, however, encouraged its members to participate in the rally and help lead it. That's interesting. So the State Nurses Association is encouraging it. That's really interesting. Okay. I don't think that's a bad thing. I just think that's really interesting. Right. So it's not fair to the patients. It's not fair to the nurses. And it looks like this is an ED nurse from University of Illinois Hospital, who's also with the Nursing Association. It looks like here's also a nurse who attended. It says she said she nearly left the profession during her first nursing job in 2020 at a long-term care facility, also known as the LTAC for my non-nursing people. When she routinely was asked to care for 25 patients. Ooh, wow! Now that's a high ratio. That's a high ratio. Is that real? A 1 to 25 patient ratio? Wow, that's high. Okay, there was no help. It was completely overwhelming. And this person says she has since moved on to a new job at a rehab facility where she no longer has that problem. Wow, one nurse to 25 patient ratio. That's really high. It's interesting. Okay, when it comes to safe staffing, the JCO said when it comes to safe staffing, the Joint Commission should take the lead as a hospital accrediting body. And then, they want to talk about a nursing shortage, but unfortunately, that's because nurses are really at their wits' end in the profession and they're just leaving. It's dangerous. All we're asking is that they help look at safe staffing with us and make it a priority. Their number one priority. Okay. All right. I have heard of nurses leaving. I have heard of nurses leaving the profession because of burnout. There's been a lot around burnout with everything that's happening over the last 2 years. It's been a lot. I'm not at the bed, and I'll be honest. Oh, I meant the preference. I have not worked at the bedside in 16, 17 years, but even back then, it could be a lot. Because you're as the nurse, patients and patient families oftentimes come to you first because you're right there at the bedside. You're there when the providers aren't there, when the social workers aren't there. If something goes wrong, the first person that the patient usually calls for is their nurse or their nursing assistant. So, all right, let's go back to the article, y'all. Let's make it big for you. Okay, let me just pull it back up. All right. So Blake, who said he worked at hospitals across the country. So it sounds like he was a travel nurse. I don't know. Was he a travel nurse? Said he started feeling burned out as a nurse about 4 years ago and considered leaving the profession. He started his Nurse Blake Facebook page around that time, partly as an outlet. So in addition to, it can be a lot. You can feel burned out. And sometimes, even if the ratios are good, and I'm just speaking from personal experience, even if your patient care ratios are good, you can feel burned out. Okay, it's just a lot. It's Thurston is because you're a human being taking care of a human being, right? And you really want to, you put a lot into your work, okay? And depending on the patient population or the specialty that you're in, if you're in really any specialty, pediatrics, oncology, burn units, etc., you see emergency departments, you see a lot. And it even taking staffing out of it, seeing that and seeing suffering and wanting to help heal and be part of the healing process outside of the staffing piece, it can just be a lot on you. So all right. So in addition to posting on social media about safe staffing, Nurse Blake also makes satirical videos, such as the one where he pretends to be a nurse manager, asking a nurse about their weekend. Oh, that was a funny one. I'll see if I can pull it up here in a moment. And in another one in which he poses as a hospital executive, giving an underwhelming thank you speech to healthcare workers at his hospital. In other videos, Jeff, he's criticized Jaco. So for him having he has the freedom to, well, I shouldn't say he has the, well, he does. Anyone has the freedom to criticize like a large regulatory or accreditation agency. But some folks can't do that without, you just never know how things come back to you or, how they impact. So it's just interesting. And all right, so he now has about 1.6 million followers on Facebook. He has done the comedy tour, which I talked about, and owns a company that offers continuing education for nurses. So I know he has a big cruise event coming up later on this year, and safe staffing is not going to change overnight. It's not going to be fixed tomorrow, but if we don't start talking about it now, it's never going to be changed. So I agree with that. It's a lot. It's a complex issue. And I've just, to the point where it's gone to the Joint Commission's headquarters. I just had not seen that. So this is Jaco's Instagram page. They don't get a lot of engagement on their pages. I noticed that. But like, if you open up any one of these like recent post, just any, I'll just pick one. I think this was the one around, is this one around workplace violence? Yeah. But you can see where nurses or people, because you don't know, you don't necessarily know who's a nurse and who's not, but you just see where folks have been flooding their Instagram page with just comments. It's just interesting, right? And I'm surprised me and Jaco have not turned the comments off on any of their videos. I mean, any of their posts. But you know what? I have a feeling if they did, it just wouldn't look good, right? The optics of it. Folks were like, oh, now you're trying to silence people. So I kind of get it. So this is Nurse Blake's IG page. Oh, he has a dedicated Jaco pin item. I didn't realize that. It's gonna open. Okay, so oh, this is from when he first posted the let's see if I can get, oh, no sound. Okay, all right, this is from when he first posted the change.org petition. And I think I talked about this in my first video, but here he goes. So this is one of the I guess satirical videos. Would you see, hold on, before this opens, you see this video has over 400,000 views. And that's why I was talking, and over 400 comments. So that's why I was talking about in my first video, if you are a healthcare administrator or in some type of leadership position, I think it's just really important for leaders, nurse leaders, not just nurse leaders, but also hospital leaders, to really be tapped into what your staff are saying. But not only on like the annual nursing service and things like that. What are they talking about on social media? But that's their right? Because their social media is not their work, as long as they are not, violating a facility's social media rules. But, it's interesting because anybody can see what folks post on social media and comments, right? And if staff are associated with a facility and they're saying things, it's just interesting. Just paying attention to those things seem to be important to me. I would imagine as a leader, just to kind of be aware for awareness. So let's see what this video. I think this is one of the funny videos that Chicago Tribune was talking about.
You gonna bow down when you see me. You gonna bow down in respect. You gonna bow down when you see me. You gonna bow down in respect.
So if you're not a nurse or a healthcare provider, the satire here is, especially when you're not, as a nurse, you're not supposed to like have drinks at the nurse's station, especially around the med carts, because the medications and things can get contaminated, or equipment can get impacted, etc. It's just for like infection prevention. You're not supposed to have like drinks and things at the nurse's station. So that's one of the satire, because it is known that it is said that, when a facility knows Jaco is coming, you need to make sure you don't have your drinks at the nurse's station, etc. So I think this is the ad here. Is this the ad? No, y'all. I believe this is the ad that they ran. Yes, it is. This commercial will be aired today and tomorrow in Chicago. Yes. So this is the ad that they ran on television television stations in Chicago this week. And I saw where one apparently ran during the Kelly Clarkson show. And you think about, who her audience is.
When you're in the hospital, it's people that save you. Nurses, doctors, staff. But what happens when hospitals are short-staffed? When nurses have 8, 10, 12 patients at once, but you're in an emergency and need help?
Did I do something? I did. Sorry, y'all. Bear with me. What'd I do? Let me go back. Bear with me here. Oh, that was it. Okay.
When you're in the hospital,
it was only 30 seconds. I thought I clicked something. Ooh.
Nurses, doctors, staff.
Yeah, that's
But what happens when hospitals are short-staffed? When nurses have 8, 10, 12 patients at once, but you're in an emergency and need help? Safe staffing mandates will protect patients and hospital staff. Tell hospitals and the Joint Commission to mandate safe staffing for the safety of you and your community.
Okay. I'm sorry about that.
When you're
I clicked on something by accident. So, and then this is the photo of where they delivered the signatures to Jaco. So it's interesting, y'all. I have just never seen it before. If you have seen it before, leave a comment below. What are your thoughts? And then the last thing I was going to share is the same, within a day or two, just this week as well, Forbes released this interesting article. So Forbes has written a couple of articles this over the past couple of months, I do believe, around healthcare and nursing and things like that. So this one says, unless we future-proof healthcare, study shows that by 2025, 75% of healthcare workers will leave the profession. And so what caught my attention about this one is the CCO, the Chief Clinical Officer of HIMSS, gave a statement, and I found it interesting. So I am a nurse who works in technology. So HIMSS is the Healthcare Information and Management Systems Society. It's one of the healthcare technology organizations. And so he made a statement about this whole thing around providers. This study that was done, 75% of healthcare workers leaving the profession. So there was a survey. Let me find it here for y'all. There was a survey done. I'm trying to find where I read it. Let's read his quote first. As a practicing doctor, I'm acutely aware of the struggles today's clinicians face in their efforts to care for patients. This comprehensive report from Elsevier Health provides an opportunity for the industry to listen and act on the pivotal guidance given by those on the front line. I commend this important initiative and look forward to next steps in supporting our doctors and nurses. So I believe this survey they surveyed 3,000 doctors and nurses. Where did I see that? I'm probably overlooking it. I think it was 3,000 because I always wonder when I see surveys and data, I'm always interested in what the N is, and the N meaning like if you survey people, how many people did you survey? Because do you have like a large sample size, a small sample size? Because that kind of depends when you start looking at percentages. But I don't see it. I thought it was 3,000. Oh, okay. No, it says thousands. It said thousands. I thought I read where it said 3,000s. But what I wanted to point out, this is just the last point I was going to make about this Forbes article. And again, I'll leave a link below. It was 3,000. Okay, I'm not tripping. All right, so Elsevier Health released the Clinician of the Future report, which was a quantitative global survey, qualitative interviews, and roundtable discussions with nearly 3,000 practicing doctors and nurses around the world. And it says that it helps shed light on challenges impacting the profession. But what stood out to me as a nurse who works in technology, so I'm a nurse informatician, was what clinicians highlight about areas for priority for greater support: enhancing health technology skills. Clinicians predict that over the next 10 years, technology literacy will become their most valuable capability, ranking higher than clinical knowledge. In fact, 56% of clinicians predict they will base most of their clinical decisions using tools that utilize artificial intelligence. However, 69% report being overwhelmed with the current volume of data, and 69% predict the widespread use of digital health technologies to become an even more challenging burden in the future. As a result, 83% believe training needs to be overhauled so they can keep pace with technological advancements. So I love working in IT. That is my wheelhouse as an informatician, but it's just interesting. So yeah, y'all, that's it. I will do my best to respectfully continue following this joint commission nurse leg, what's going on around like the petitioning around safe staffing and the news story, because it's interesting. We haven't seen this before, not done like this. Okay. So yeah, if you have a comment, a thought you want to leave below, respectful comments are always welcome. My contact information is in the description. Okay. And if you made it this far, thank you. And I'll see you in the next video.